Good morning and welcome to the Elias Makos Show. I'm Sue Smith, sitting in for Elias, who's taking a well-earned vacation. And great to have you with us this morning. I'll be here until Friday. I want to talk about this really upsetting story about a Montreal man who has taken his own life after trying repeatedly and failing to obtain medical assistance in dying, otherwise known as MAID. 43-year-old Vincent Berthiaume was a former theater teacher. He'd been living with chronic pain for 2 decades. And he had tried many different treatments and eventually applied for medical aid in dying. He was refused 3 times. And his family is now speaking out. They say the system failed him and they want some answers. There is a coroner's investigation underway. Dr. Georges L'Espérance is the president of the Quebec Association for the Right to Die with Dignity. He joins us on the line. Good morning.
Yeah, good morning. Thank you very much for the invitation.
What went through your mind when you heard about the death of Monsieur Berthiaume?
Well, first of it, it's very sad that a man can go down to a suicide. It's very sad for him and for his family, of course, and we offer them all our sympathy. Next, beside that, for sure, I will not do anything on that file because I don't know the file. But in those problems with chronic pain, we have pretty often some patient asking MAID for chronic pain, but we have to look first at the reason of that pain. What is the underlying problem that will bring that person to have that kind of pain? Second, when we look at the file and the patient, we will understand what is the pain of the patient, and we'll try to verify all that with a very thorough clinical examination. Third, what are the investigations that have been done? What are the treatments that have been done for that patient? And that's all questions that we must answer and we must find in the file and we must understand. After that, if we have many good reasons to understand what is the pain, why is it there, why there's no answer to all the treatments we can offer the patient, then we can look at MAID. And we also have to look what are the what we call the comorbidities. What are the other factors that patient may have presented in the past to have that kind of pain and that is not treatable. So that's very complex cases, and of course I will not comment on that special case because I don't know the case.
Right.
But generally, that's what we're doing with a patient with chronic pain.
But so, Dr. L'Espérance, I find the whole thing about chronic pain is interesting because. So how does the law stand right now? My understanding is that it has to be imminent. Death has to be imminent and not avoidable or not curable. There's a word that I'm not thinking of properly. Is that true?
Not exactly, because since 2021, the death doesn't have to be imminent. It was true at the beginning since 2014 in Quebec and 2016 in the Criminal Code in the rest of Canada outside Quebec. But since 2021 and since the case in Quebec with Gladys Truchon, the patient must have a grave and irremediable disease, which a decline in his situation, and with pain. Mm-hmm. So, in those problems with chronic pain, of course, we have to examine that very profoundly, so that we can find what is the reason for that pain, mm-hmm. What are the treatments that have been done, and also is there comorbidities, which may be psychiatric or physical comorbidities. So we have to do a very important research on the case of each patient for that problem with chronic pain.
And whose responsibility is it to do that research? Because presumably, and I understand you're not commenting on this case specifically, but presumably this individual had, already tried a bunch of treatments and was sort of at the end. Like, who is responsible for saying yes or no, you cannot have MAID?
Well, the law is made the same thing in the rest of Canada. There is one evaluator, doctor or nurse, that will evaluate the patient, all his files and everything like that. And then this doctor, which we call a provider of MAID, doctor or nurse, will evaluate all the file and will evaluate the patient, of course, we'll listen to him and then say yes or no that patient meet the criteria to have medical aid in dying. What the same criteria that are in Quebec law and also in the criminal code. So that's the first person, the first provider who will do that evaluation, and then a second doctor or nurse will have also to evaluate the patient to see if that patient is eligible or not to MAID. So there's a two-way, so if I can say that, to a provider to look at that.
Yeah, there's basically safeguards in the system.
Yeah,
but I'm wondering is, in your view, are these restrictions in this process maybe too restrictive for chronic pain patients?
I don't think so, because we used to see those patients. But the other thing is that a patient like him or any other kind of patient that is refused at the beginning may ask for another opinion, for another evaluation if that patient wants to. It's totally up to them. Of course, if after 2 or 3 times a patient get the same answer of different professionals, well, then the answer is pretty clear. But it's the right of every person to have another evaluation if the first one, for MAID or for any kind of treatment, in fact, if the first one doesn't answer to the question of the patient.
Yeah. I mean, I guess it's interesting, and I take your point about all the criteria, the reason, the level of pain, and the treatments that have been tried. But I guess at one point, if the person says, no, I'm at my limit, how do you evaluate that?
Yeah, you're right. It's absolute right of each patient to have or not having treatments. But also, if there is a very simple treatment for something, and I'm not talking generally of chronic pain, but if there is a kind of simple treatment and the person refuses that simple treatment, which is not invasive, for example, surgery, well, in that situation, we will have to evaluate the reason for the patient to ask MAID. But as I told you, for chronic pain syndromes, it's pretty difficult because it's very complex, and we have to evaluate the patient on multiple axes, which are also physical but also mental health. So we have to evaluate the patient on those multiple axes to be sure that patient may have access to MAID if he wants to, but have good reason to have it. But many patients will have chronic pain syndrome, whatever the cause, may have access to MAID. But as I told you, the first thing is, what is the reason to have that pain? First of all, what are the investigations that have been done? What are the treatments that have been done, et cetera, et cetera?
Right. All right. Well, thanks so much for lending us your expertise on this. I appreciate it.
My pleasure. Have a nice day for you.
You too. That is
Thank
Dr.
you.
Georges. Bye-bye. Dr. Georges L'Espérance, he's the president of the Quebec Association for the Right to Die with Dignity, talking about this case in which a man who suffered from chronic pain tried 3 times and failed to get MAID, and he ended up taking his own life.